mental health services, we've got some real challenges that we are going to have to face. One is we're starting from a fairly low baseline. Great stuff been done over the last few years, but we're not very far forward yet. Secondly, the long-term plan produces some very important targets, but they're going to really stretch us. The good news is there's a lot of money being invested in mental health, 2.3 billion over 5 years, and we're going to see continued investment in mental health. But with that large amount of money being invested over a short time, there is a real capacity issue to make sure we use it creatively, transformationally, and not simply to roll it after what we're already doing, because if we do more of the same, we're going to get more of the same. We need to do things differently. Ultimately, our biggest impact is always going to be on prevention. We need to get in early, we need to get into schools, we need to get into colleges, work with our children and young people so that we prevent the development of mental ill health later. We all know 50% of mental ill health starts before 14, 75% before 24 years. We've got to get in, otherwise we're going to pay the cost of that later on. In parallel with that, we need to create a safety net of good crisis services so that if an individual has a crisis, they are going to be caught, scooped up and put into proper services that are going to help them recover and get back to normal life. Once we've got that safety net in place, we need to continue to develop our community services so that we're intervening early before people get into crisis. We need to be able to say, this person's getting close to crisis, let's act now and not after they've gone into crisis. An example is with young people, sometimes they're considered not ill enough to get services. That's a crazy concept. We've got to get in early so that we can prevent that severity developing over time. It is absolutely vital that we collaborate with other areas of the long-term plan. Simple example, we know that people with a severe mental illness tend to die, depends on the figures, 15 to 20 years earlier than their peers without a mental health problem. That is largely down to diseases like respiratory illness, diabetes, heart disease. So we've got to work with those other areas to say we need to ensure that our people with severe mental illness get proper physical care as well. There's an equal and opposite parallel that people with a long-term condition have poorer mental health than their peers. So we need to make sure that every long-term condition that's being managed, and particularly those under the auspices of the long-term plan, are given proper mental health intervention and interest and help and support so that they do better with their physical health because their mental health needs are being met. I've really enjoyed the conference today. Particular highlight for me was Emma Thomas talking about children and young people. She's from Young Minds. And I think we have got to have a focus on our children and young people, because if we don't, we're going to pay the cost, we're going to reap the consequences much further down the road. There's a lot of work that is happening, some really interesting stuff going on, but there's much more to do, and we've got to focus on that if we're to get a good situation, not just 10 years from now, but 20, 25 and 30 years from now.